Well, let me tell you what a thrill it is really to be standing here and accepting this award from the ASHP Foundation and from Cardinal Health as its sponsor. I want to thank you very much for just providing the opportunity for us to apply. I really don't think we thought we were going to be a finalist when we submitted it, but we are so thrilled to have this opportunity. And I want to extend our thanks on behalf of all of VISN 21, which everyone tells me we have too many acronyms in the VA. So the VISN is the Veteran Integrated Service Network for the VA, and it's a regional area. And there were so many people involved with this project, and I noticed the film doesn't even do justice to the number of people that we had presenting for the project, and we really appreciate all of you coming and looking at it. I first of all want to thank the larger VA for our VISN support. We are a group of pharmacists for the last 10 years who have been tasked with managing the clinical data warehouse for our region. And I think we're the only pharmacist unit in the VA who actually has the privilege of managing all this data. And so I want to thank my boss, who is Mary Ann Johnson, a geriatrician who is the Chief Medical Officer for VISN 21. Also Sheila Cullen, our director, who in the VISN has unwaveringly given us support over the last 10 years to do this project. And so we're very grateful for that. I also want to thank some of the directors directors of pharmacy, as well as the pharmacist-led teams, who at each of our 6 medical centers were responsible for coordinating the events of putting this medication dashboard into actual practice. Those include the VA Northern California, Julio Lopez, and we have Robert Malmstrom here, who is the pharmacist who actually led the local team there. The VA Sierra Nevada, we have Beth Foster, who is the Director of Pharmacy, or the Chief of Pharmacy, and we have Scott Manberg with us today, who is also the pharmacist-led team member who supported that area. We have VA Palo Alto involved, and Kelly Robertson, who is the Chief of Pharmacy there, and Noel Hassan, who couldn't be with us, are 3 of the areas that we were able to highlight to show that the work that they had done at their medical centers with the various teams of multidisciplinary nature were able to accomplish what we thought were phenomenal outcomes in actually decreasing hospitalizations. And last and not least, I really want to recognize my VISN 21 PBM team. These folks are trained clinicians who have now become health analysts. And so the dashboards that we're actually creating are created by pharmacists writing code from the electronic medical record and pulling in data that we think are clinically significant endpoints. So I specifically want to mention Joy Meyer, who is here with us today, Diana Higgins, Amy Robertson, who couldn't be with us, Bob Coleman, and I want to also specifically mention Samantha Wright, who is now in VISN 12, and she was the resident, the PGY2, that actually started this dashboard idea. And she isn't able to be with us, but she was really sort of the instigator of the original pilot. I also want to recognize 3 of our PGY2s last year, who are our PGY2s in pharmacy outcomes and health analytics. We're trying to take pharmacists who are clinicians and who know how to manage one patient at a time and turn them into people who can actually manage populations of patients. And these folks are board certified. They go through a PGY1 and manage lots of patients, and then they come to us and we actually teach them how to code. And so this idea also hatched out of the PGY2s. We sort of talked about, gee, wouldn't it be cool if we could put this program together? And the PGY2s actually wrote the original manuscript that resulted in our submission. So that would include Vanessa Vaupel, who is with us, Chad Kay, who is also with us, and Chandra Steinhook, who could not be here tonight. As pharmacists, clinicians, we have been working in ambulatory care. Joy is, in addition to an analyst, she's a PA and a PharmD and board-certified clinician. And so we have been seeing patients for over 20 years in the ambulatory care environment at the VA and knew that there was a lot of data in our electronic medical records that we wanted to capture and turn into real information. And so about 10 years ago, we started this project of coding into our electronic medical records, and it's pretty much turned into a pretty big production now. And we feel that we're, if not on the bleeding edge, certainly on the cutting edge of this kind of technology. And we are so excited every day about the work we do, honestly. I am so thrilled about what we get to do every day. And it's really a pleasure to turn the work that we've done into a population management environment, which I think pharmacists have an incredible role in over the next few years. So it is with that that I will